Thank you, Mr. Chairman, and I offer this amendment with the sponsorship of Mr. Welsh, also Mr. Doyle, Ms. Baldwin, Ms. Schakowsky, Mr. Rush, and Mr. Engel, and I think with the support of many Americans who are asking fundamental questions about the way the bill we're considering is structured and whether or not there is a better way. This is an amendment that would strike the guts of the bill and replace it with a single-payer option that would, I believe, be less expensive, more simple, and would ultimately cover more people in a way that they understand and know. Let me begin by saying that we have tried with some success, but a great deal of confusion, to jerry-rig a healthcare system on top of the foundation of the private insurance model that if we were going to start from scratch, we would never choose. We'd never choose it because it's expensive. We'd never choose it because it's complicated. But we primarily never choose it because the insurance company's role in this is fundamentally contrary to what our role should be as members of Congress. They have an incentive, not because they're bad people, but because it's what they do, to take money in exchange for offering the service of health care. But they're not providing any health care. Let me begin by making something very clear. We all have single-payer health care now. We have a single-payer health care whether we have private insurance, whether we have Medicare, whether we have TRICARE through the VA. We take money, we give it to someone, and then we go visit doctors. Some of us have a choice, but most of us really don't. Most of us who have health insurance through our businesses can't just go out and say, I want to choose another one. Most of us don't have a choice to shop around when we're sick to say, oh, I'll have my gallbladder removed some other time. I'm going to shop around a little bit first, or never mind my gallbladder, could you work on my liver a little bit? So the mythology that there is a lot of choice that consumers have now is just that, it's mythology. Under a single-payer plan, the way it would be structured is you pay a payroll tax, then you choose a doctor, you go to the doctor, and from your payroll taxes or the taxes that you pay in other ways, they reimburse the doctor. That's it. To show you how it looks on a chart, this is it. Plain and simple. No 800 numbers, no problems with pre-existing conditions. This is it. And what's the benefit of this? Well, you take this, of the $2.2 trillion that we pay, this $775 billion that goes to private insurance, of which about, say, $295 billion of it is profit and overhead, and it goes back to you, the taxpayer. It goes back to you, the patient. It goes back to you, the doctor. It goes back to you, the hospital. It doesn't go to the hospital. It doesn't go to the insurance company. That's it. Plain and simple. Now, what can we do with $293 billion of profits or $775 billion a year? And that ignores something else. That ignores the fact that there's about $270 billion in out-of-pocket costs that we pay each year. Well, some people around here are saying, let's come up with a system where we take private insurance companies, we put a public option on top of it. Left and right have been saying the same thing about the public option. We need the public option to compete to drive down prices. That's what the left says. The right says, oh, we have to make sure we harness and make sure the public option isn't too strong because we're afraid, so we're afraid that that public option will drive down prices too much. Both sides are saying the same thing and are saying the same thing. You got to get some kind of option over there. They're saying the same thing. They're saying if you have a public option, people will choose it. Doesn't that tell you something? When my friends on the right say, oh, we can't make it too strong, they'll drive out the private plans. Aren't they saying that consumers are too dumb to make the correct choice? And when folks over here in the construction of this bill and my friends in the Blue Dog say, oh, we have to be careful. We can't have too strong a public plan because it might gobble up all of the business. What they're saying is that consumers would prefer a public plan, and they're right. Overwhelmingly, people, when they look at Medicare, say, you know what? That's a public plan that I like. That's a single-payer plan that I like. That's a government-run plan that I like. And overwhelmingly, the doctors in the hospitals say that they like dealing with them. Now, make no mistake, one of the concerns that I've heard raised about the public plan is they talk about the problems that Medicare has. No doubt about it. We have to fix them. But if Oxford Insurance, just to pick out one, has problems that we don't like, what do? Well, we have two options. We can get on an 800 number and complain, or we can buy shares of stock in that company and try to change the policies. If Medicare has problems, or a single-payer plan has problems, you know what we do? We go to the government officials, or we go to Congress, and we say, we're going to change those rules. If you don't like the reimbursement rates, we're going to change them. If we want to incentivize preventative care, that's what we're going to do. Now, why did this rise up this way? Why did we create this type of a system? Because we haven't acted. Well, now, ladies and gentlemen, we're acting. This is as close as we have to starting from scratch as we're ever going to have. Why is it, I say, Unanimous consent for one additional minute. Why would we take this plan that is flawed and expensive and try to jerry-rig it on? And if I've heard one concern about this plan that we're voting on today, which is certainly better than the status quo, but not as good as a single-payer plan, people say, I'm confused. What does it mean? What are all these new things I'm learning about? Go home over the break, my colleagues, and say, you know what? We're going to provide you something like Medicare when you're 45, when you're 35, when you're 25, when you're 15, when you're born. And they're going to get it. They're going to understand it. And they're going to understand what it means because it makes sense, it's simple, it's cost-effective, and it covers everyone. And with the money that we save, we're going to give people tax cuts, or we're going to get them better roads, or we're going to get them better research into coming up with cures for new diseases. We are no longer going to take hundreds of billions of dollars every single year and give it to insurance companies who do bupkis in return. They don't give me a checkup. They don't give me an operation.
Gentleman's instructed to speak English.
Well, I thank...
and your time has expired.
I thank you. I urge a yes vote.